Much can be done to prevent or to control diabetes, and this section reviews some of the key factors. In the last section of preventing diabetes, we left on a sobering note because many preventable deaths are related to high blood sugar. In this section, we're going to look at the good news related to diabetes. We're going to discuss three things. Number one, most cases of diabetes can be prevented. Number two, we're going to talk about the 4 healthy living factors and the 10 ways to prevent diabetes that are lifestyle measures. And we're going to find that they significantly reduce the risk of developing diabetes. And number 3, we're going to find that prevention is the key when it comes to dealing with the disease. Preventing diabetes will cut medical costs and increase quality of life immediately. While the information we've just gone over in the last section is serious, there is some positive news about diabetes. Did you know that most cases of type 2 diabetes can be prevented? There are large studies that have shown that if we are eliminating things that put us at the risk for diabetes, we can prevent most cases from happening. For example, the Women's Health Study found that if we cut out the factors that we can change, that we could prevent up to 90% of type 2 diabetes. The Nurses' Health Study showed the relationship between lifestyle and the risk of developing diabetes. It was a large 16-year-long study that included more than 84,000 women. 4 risk factors were studied. They included weight, activity level, diet, and smoking. The results showed that lifestyle choices are responsible for up to 90% of all diabetes, even in women who had a family history of the disease. Women who had none of the 4 risk factors cut their risk of diabetes by 89 to 91%. These women had these factors in their lives. They were active 30 plus minutes most days of the week. They didn't smoke. They were of normal weight with a BMI less than 25, and they ate a good diet. This means that they ate lots of fiber, ate low glycemic foods, and ate low polyunsaturated fats, and they avoided trans fatty acids. This large study that was printed in the Archives of Internal Medicine and had over 23,000 people involved and were studied for over 8 years, this study looked at people who followed all 4 healthy living factors and compared them to those who didn't follow any of them. Those who followed all 4 healthy living factors had a much lower risk of getting diabetes. Their risk was only about 1/10 compared to those who didn't follow any of the healthy living factors. So let's look a little closer at those 4 healthy living factors. So here are the 4 healthy living habits or factors that can cut the risk of diabetes type 2 by 90%. They include never smoking, keeping a healthy weight with a body mass index less than 30, staying physically active, for example, getting at least 3.5 hours of exercise per week or breaking it down to 30 minutes a day, and having healthy eating habits, which means eating a lot of whole grain breads and cereals and plenty of fruits and vegetables and limiting red meat. And talking about these things, we're going to be actually diving deeper into each of the principles as we go through the rest of the program. Notice what is highlighted in yellow. Okay, so let's ask a question. Which of the following is one of the 4 healthy living factors? A, using a computer. B, drawing pictures. C, never smoking. Or D, eating junk food. All right, settle in on your answers. Preferably write them down. When you hear the bell, put down your pencils. And the answer is never smoking is one of the 4 healthy living factors.